Welcome to Glow for Hope, sparking conversation on mental health, where we break the silence, build community, and ignite hope. We're here to talk about what really matters: mental health, wellness, and the conversations that help us all feel seen and supported. Every episode will bring real stories, expert insights, and practical tools to help you navigate mental wellness and suicide prevention. Because together, we can change the conversation. Let's get started. Welcome to another episode of Glow for Hope, sparking conversation on mental health, where we're having real conversations about mental health and suicide prevention. Because when we start talking, we start changing lives. I'm your host, Kelly Poelker, and today we're talking about a population that doesn't always get the attention they deserve in mental health conversations. We're talking older adults. Think about it. These are people who have lived through more loss, more change, more hard chapters than most of us have faced yet. And for a long time, the message they received was push through. Don't talk about it. Handle it. Today's guest has spent more than 30 years walking alongside people in some of the hardest moments of their lives. From foster care to hospice, from inpatient care to community mental health, she's seen it all. She now serves as the executive director of the St. Clair County Mental Health Board, where she and her team work to make sure people in our community at every age and every stage have access to the care they need. Jodi Gardner, thank you so much for being here.
Thank you, Kelly.
So, Jodi, with 30 years of experience across so many different settings, what is it about older adult mental health specifically that you're passionate about?
Well, it really is where my heart is, working with that population for quite a bit of time. Keep in mind that the age range of saying someone is an older adult, over the age of 55, there could actually be 3 generations of people. And someone who's 55 may not see the world or cope the same as someone who's 75 or someone who's 95. So you really have to specify, what generation and what experiences people have had to determine what they might be facing and how their mental health is holding up.
Mhm. So, and that's also kind of, when people hear senior and they picture one thing, and, when the reality is so much more nuanced than that, like you're saying with it, it can be 3 generations.
That's right.
So what are the factors that make mental health in older adults unique and different from what younger people are navigating?
Well, you started to say some of that before. An older person who has, lived so many years has had the opportunity to have so many life events. Some of them joyful, surely, but others that are tragic. And a younger person who's not married wouldn't know what it's like to experience the death of a spouse that they've been married to for 50 years. So older adults have so much life experience, but also so much exposure to sometimes traumatic things that have happened. And as we look at these generations, in the over 55 group, the world has changed quite a bit. Hopefully some for the better. There were times when people in that age range didn't talk about things like their mental health or didn't talk about abuses that they suffered. Divorce wasn't an option. Women may have been harassed in their workplace. There really wasn't any help offered to maybe some of our veterans coming home or just for family incidents that were happening. So this generation of people really have seen some tragedy.
Yeah, definitely. Especially when you think back to war days, and I mean, not that we haven't had some wars over the last 20 years, but
Mhm.
it's very, very intense, and not to be able to go anywhere for support.
Mhm.
Are older adults actually coming forward and seeking help, or is that still a significant barrier for this generation?
It depends. Some of the younger older adults are maybe more open to that than an older adult would might be, but that the benefit of reaching retirement age or having more freedom, in their lives, in the older adult and caregiver counseling program that I worked in for so long, people finally had a chance to maybe pay attention to their own needs. Or if it hadn't been overly acceptable to talk about some of that before, maybe someone in their 70s was coming to counseling for the very first time ever, and they may be addressing life events that happened in their childhood or in their early adulthood. So I think there is a growing willingness, to talk about past traumas and mental health.
Mhm. Do you think that having, like, the younger like, younger children and stuff to help encourage them to get the help that they need
Mhm.
is a factor as well?
I think that's true. I think, generationally, people are more open, and so, we model to all of our family members. So just as those, now adult children maybe learned work ethic and kindness and other things from their parents, maybe their parents are seeing that it's acceptable to reach out for counseling or to a support group or any kind of social support kind of group. I think there's an openness now that there hasn't been before.
Good, very good. How does physical health factor into mental health as people age? Is that relationship different for older adults?
I think that certainly physical health and mental health at every age are intertwined. But for an older adult, physical health can affect their mental health in ways that maybe younger people don't have to worry about. When someone's older and having more incidents of chronic physical health things like having arthritis or chronic pain, or the onset of different diagnoses that treatments are needed for. Of course, that's going to weigh, more heavily on their mental health. And I think too that there's a tendency toward sometimes more worry or more anxiety. A number of older adult clients would tell me, I wouldn't have reacted so hard to this when I was younger, or I was so busy I didn't have time to worry. So I think that there might be a bit of a tendency toward, anxiety and depression that people didn't have in their younger years. But that's absolutely individual and can't really be totally lumped into a group. But I think it's true that there's some extra challenges for older adults.
Mhm. And it's a cycle too for, like, we're in the sandwich generation. And so it's like what's stressing your parents out, and then you're getting stressed out trying to take care of your parents, and everything's just it's a lot to deal with sometimes.
Mhm.
Plus, then as you get older and you still have your parents, and I mean, with the chronic pain and things like that,
Well,
it's a lot to deal with.
I was surprised to know that I'm not very far at all from being considered an older adult. So mid 50s, I would fit not only the older adult category, but before losing some family members, I was certainly a caregiver as well. And I know that there are families that have, say, a 55-year-old and a 75-year-old, and maybe that next generation generation of someone in their 90s still living. So you can be both an older adult and a caregiver all at the same time. Certainly, spouses are caring for spouses. We have older adults who are caring for younger disabled children. So it, there's just a whole combination of circumstances about being an older adult and being a caregiver that's just hard. But that's why there's some of the resources out there that there are.
Lot of layers there. Are there specific barriers that get in the way of older adults receiving the best care, even when they do reach out?
I think there are a few barriers. One barrier that's kind of ironic is that younger doctors and therapists sometimes feel that they're being disrespectful by asking certain questions, or they feel embarrassed asking intimate kind of questions to someone who's their senior, but that's actually a barrier to care. If a younger doctor or therapist, isn't asking an older adult, if they're skipping parts of an assessment that might include asking questions about alcohol use or overuse, asking questions about sex, asking questions about recreational drug use, or asking about even just their mood or situations in their family, then they're missing an opportunity to make, an accurate assessment of a situation.
Along the same lines, I think as I continue to take my mom to more doctor's appointments,
Mhm.
and she's probably shoot me for saying this, but she's 87.
Mhm.
And doctors are a little bit more dismissive, like
Ah,
because of your age, we don't need to worry about this or we don't need to worry about that, and
ah.
and that's not right.
No, no. I think there are times when, if a family member is in the room, a doctor may turn to the younger person to ask the questions rather than letting the older adult speak for themselves. So hopefully you have doctors and specialists and mental health clinicians that just see the older adult for the full person that they are, with all of their history, all of their needs, and that they do an accurate assessment of both physical and mental health kind of symptoms.
When it comes to isolation,
Mhm.
are there tips for both sides, the kids, the caregivers, as well as the older adults to overcome periods of isolation? And
And that's very individual. I know 90-year-olds who are extremely active in travel and volunteerism. And then I may know a 64-year-old who's quite debilitated and homebound. So age doesn't necessarily tell, as much as full circumstances, but there certainly are people who are isolated. And, I didn't plan on telling this story, but it is something that I talk about sometimes to demonstrate. It may be helpful for a younger person to hear this. So, one of the times that I went to do a counseling visit at someone's home, because that's what my job was, I was hectic that morning and I was rushing up to the door and knocking on the door and breathing hard. And I was thinking, gosh, it seems like I was just here. I was probably there about 2 weeks before.
Mhm.
And I was flustered and thinking, boy, this is all just moving so fast. And this dear lady opens the door and she says, "It's been forever since you've been here." And I thought, what a difference of life perception that was. And that made me very aware to be absolutely present with her, that she was enjoying that time, both clinically and socially, and that, maybe nobody had knocked on her door between the time frame that I had been there and not. And it's good for younger generations to realize that while their life is busy and full and they go and see so many different things and people, how meaningful it is to be present, truly present for someone who maybe hasn't had, the luxuries of that if they're homebound or just more isolated for whatever reason. During COVID, it was hard on homebound older adults because well meaning younger people were absolutely correct to think, I don't want to bring any illness to them.
Mhm.
But I think also some younger people used that as an excuse to not stop by. There certainly could have been creative ways to keep in touch that I think many older adults missed out on and younger people chose not to do. So I hope we've learned something from that, that isolation serves no one's mental health. And there are many volunteer opportunities. There are social service kinds of programs like the Senior Companion Program through PSOP that, have volunteers that visit people at home. There are resources out there that kind of all added up together really can make a dent in that isolation.
Is that mainly for people that like have no family, or if they have family and the family just doesn't spend time with them?
Yeah,
All of the above, I guess.
all of the above. I'd have to, direct you to those programs to find out the exact eligibilities and details, but there are places to go. There are older adult counselors that visit people in their home. There are assistance kinds of programs for homemaking. And then there are places in the community as well to not only gather socially, but places that might, like as a group, serve older adults for their mental health.
It's so different these days. From even we spent so much time at our grandparents' house, and even collectively as a family, aunts, uncles, cousins, and cousins of cousins, and just everybody gathering around for the holidays or even birthdays. I think for the most part, what I've observed, it's just not like that anymore. And
Fam-
I think, like when you compare it to, um, I guess the Asian culture or even the Hawaiians, and just having, they look to their elders, and it's a whole different ball game and a whole different culture compared to how things are now. We don't rely on them and all the stories that they can tell, and it it's sad. I'm probably guilty of it myself to a degree, just, 'cause the age of when I still spent time with my grandparents, but it wasn't the same, because I was young and running around doing my sports, had my friends and all that. But there's so much that you can learn from having a conversation.
Absolutely. Absolutely. And not that older adults aren't also, very aware and accepting of, all of the things that their younger family members do. But, maybe inviting them along or having that conversation would be something that you just wouldn't want to miss out on. I think that these generations of older adults are open to volunteering. Many are choosing to remain in the workplace longer. Of course, some of that could be financial, but some of that could also just be that purpose, that you mentioned. The purpose really is the key to someone feeling that their life is still worth living. So that could be out in the community, that could be for their family. Not a good idea to overburden older adults with responsibilities like full time babysitting, but, spending that quality time where they get to be, the fun person, those memories are priceless, remembered by everyone, remembered not only by them, but for the kiddos, that they got to spend the time with. But that purposefulness, if you think about, sometimes we try to take burdens off of our older adults, like, no, don't mow the lawn anymore. You're not really up to that. Well, we'll have somebody come in and clean for you. Try to balance the reality of what an older adult might need help with versus how they can still be recognized doing meaningful things. So if that's taking care of their own home, if that's not feasible and one responsibility has to be replaced by someone else fulfilling that, but then maybe there is a time that that person is consulted about family history or life decisions, or there's just a special time given, in recognition of all of their experiences or knowledge, somehow to make sure that they are aware of how purposeful and how valuable they are.
Yeah, we all have to have purpose, don't we?
Hmm.
What makes it all worthwhile.
Hmm.
And I think you mentioned something about, getting other people to do things for them. Or, I mean, I figure at least with my mom, that if she's physically capable of doing it, I don't want to take that away from her
Hmm.
unless she says, I really don't want to do this anymore,
That's right.
which she has said on some things. But
Yes.
it's, it just, mobility is such a huge part of things, and just keeping them up, and movement of any kind rather than just sitting around, and
Mhm.
can make all the difference.
Yeah. And it really does make a difference for an older adult to be involved in that kind of decision making. For a group of siblings to gather and make decisions without including that older adult in those decisions, when said like that, obviously doesn't sound like a good idea. And yet, there's a lot of times that families will sort of collectively decide that without including the older adult in the decision. Sometimes there are factors like the start of any of the kinds of dementia that might limit the older adult in their reasoning. And then in those circumstances, it's a matter of being respectful and including them in as much of the decisions as is safe and reasonable. But I so many times saw that happen even when an older adult was quite capable of being logical and reasonable and, part of any kind of family decisions going on. So my hope is that people are just respectful and inclusive and as kind
Yeah,
as can be.
it comes full circle, doesn't it? So I want to make sure that we covered, talking about strengths. What does this generation do well when it comes to resilience and mental health?
Well, just to reiterate, that I think overall, these generations of older adults are more invested in their own well-being and care. And we might still hear from time to time, people not questioning their doctor, or leaving decisions up to other people. But I think now, older adults are more involved in kind of a care plan and a decision making. They're more accepting of things like counseling and of, creative kind of interventions. Maybe an older generation might not be agreeable to something like yoga or meditation or other kinds of stress reduction things. But, many people in those generations now are so well rounded and are practicing things that keep their health well. So I just think overall, these generations of older adults are smart and savvy and invested in their own care and wanting to still enjoy those years of their life.
Yep. To have a good quality of life for the time that remains, however long that might be. So for someone listening who's worried about an older adult in their life or who's that old or somebody that is that older adult, what resources are available right here locally?
There's a number of different senior citizen focused kind of resources. For specifically for mental health care for older adults, SWIC's Senior Center, Programs and Services for Older Persons, has a whole array of social and physical kind of activities, but they also have a free of charge older adult and caregiver counseling program where the two fully licensed clinically trained counselors can provide counseling services. The unique thing about it is that you can certainly come to their office if you would like that setting and like that privacy, but they will make a home visit to you if you're a caregiver and not able to leave your loved one, or if you're not driving anymore, or if you have mobility or other transportation kind of issues, they'll come to you. There's also the Memorial Senior Counseling Service, which is a small building on the campus of the Belleville Memorial Hospital that is only for older adults, and they have both psychiatrists for medication management and counselors that are there and provide both a medical and kind of a social kind of a setting. While the SWIC program is free, the Memorial program would look at billing Medicare, but they would work with you to see, what would fit. Heartlinks Grief Center sponsors a number of support groups that some seniors may participate in. And then there are also more practical kind of resources through Area Agency on Aging and Southwestern Illinois Visiting Nurse Association. They provide screenings for things like your eligibility for having a homemaker come into the home to help you, or having a lifeline call button, or being eligible for adult daycare. So there are a number of services that can be pieced together. And if you start with PSOP or you start with Area Agency on Aging, they can point you toward any of those resources.
And we'll include them in some links in the show notes from the episode too. So, what's one thing that you want someone listening today to walk away with understanding?
Well, if you are an older adult or if you are a caregiver, uh, I would want you to know how meaningful and valuable you are in that life stage. And if you are a younger person, I would encourage you to learn maybe more about that older adult in your life as they are now and maybe as they were younger. Just increase that purposefulness and conversations about that value so that everyone knows how valuable they are.
It makes me think of for Christmas, my daughter got my mom some kind of book that like had questions in it to, just to document life or whatever. I forget all the specifics around it, but one of the very first questions in it was very simple, and it happened to be after she gave it to her for Christmas. So there were several of the kids that were still sitting around, and they got the biggest kick out of the answer, and they'll never forget that conversation with her.
Mhm.
And I think that's awesome. So anything else that you think anybody wants to or needs to hear today before we wrap up?
I would just encourage you to follow up on what Kelly said about those conversations. Um, there were things that I didn't know, great stories that I didn't know about my mom until weeks before she passed away, and would have loved to have talked about some of those things earlier. So just start asking some questions. An older adult may not think anybody's interested in some of that history, but I'm betting you'll come up with some really great stories. So
I agree.
I encourage you to have those talks.
Jody, I want to take a minute before we close out here to just kind of give a little insight into what a mental health board is, specifically the St. Clair County Mental Health Board. I have to be honest, before starting Clover Hope and connecting with you soon after, I didn't pay much attention to St. Clair County Mental Health Board. I knew it existed, have no idea, or had no idea what it really did. So I suspect a lot of our listeners feel the same. So let's start there. What is it, and how does it work?
Well, so a mental health board, which is also known as a 708 board, is usually based in a county or a township, and we take the tax dollars that are designated for mental health services, substance use disorder services, and intellectual developmental disability services, and make sure that they get out to the agencies in the county that need them. In addition to the funding piece, we also act as kind of a network hub for social service and mental health agencies, just coordinating and bringing together so that when somebody does need services, they can be directed to the right place.
Okay. And you actually fund like over 20 agencies in St. Clair County. And some of the names on that list, I guess, would probably surprise people. Can you give us a sense of who those partners are and what kind of services they provide? And you don't have to list them all, but uh, give us an idea as to who they are.
Sure. Um, well, we're glad to be able to be a help in the funding realm. There is concern right now that many agencies aren't getting some of the federal and state grants that they might have had in the past, or worry that those funds have been decreased. So while no mental health board could make up those dollars, our budget is actually very modest. We try to supplement and provide services that might not be paid for otherwise. So, some of our agencies, like for mental health services, we provide funding towards some programs that don't have funding in any other way. For instance, we fund the older adult and caregiver counseling program through a local senior center. That's a no charge program because of our funding and other funding that they receive. We provide some counseling funding for Hoyleton Youth and Family Services for their Puentes program, counseling that's provided specifically for people who are Spanish speaking. And then there are other agencies like Chestnut Health Systems, Comprehensive Behavioral Health Care, uh, other agencies that provide already a whole array of mental health services, but our funding might help cover something that isn't covered otherwise.
Mhm.
Then in some of the other categories, our IDD agencies include places like Illinois Center for Autism, the Epilepsy Foundation, SAVE and Community Link, the Cerebral Palsy Association. We want to make sure that that population of people has some specialized programs specifically for them. And in the substance use disorder realm of service, Amare and Task are a couple of our agencies. All of these agencies are out there every day doing good work that may otherwise go unnoticed.
And one of the things that really caught my attention is the St. Clair County Suicide Prevention Alliance. And uh, tell us about that. How did it come together? What does it actually do?
Well, the St. Clair County Suicide Prevention Alliance is a project out of our mental health board office in conjunction with the St. Clair County Health Department. It actually came out of the I plan for things that they wanted to focus on in St. Clair County. And so the alliance is made up of people from certainly all of the agencies that we might have a part of funding, but other social service and mental health agencies out there as well, and any interested person that wants to talk about suicide prevention. We meet monthly by Zoom. We review a number of topics monthly, and we're preparing for some events that happen around Suicide Prevention Month in September.
When we talk about suicide prevention, we often talk about it as if it affects everyone equally, but that's not true. Are there specific populations in our community that carry a higher risk, and why is that?
There are, and certainly, Glow for Hope is part of the Suicide Prevention Alliance and is certainly part of trying to reach out to the community to all kinds of different populations. It's just about people being individual, I think. Certainly, youth have a higher suicide risk because of some of their specific life circumstances. But then other groups of people, uh, their risk might not be often thought of or might not be well known. We know that the construction and labor force has a rate of suicide that we would like to see decreased. We pay special attention to veterans and their military families. There are special circumstances for older adults that make some of their risk different than other age populations. And there are special circumstances and so special outreach for the LGBTQIA community as well as the African American community. I think we all just need to know that, these things don't divide us into different populations. We are all here to support one another, but we do want to make sure that an individual in a population, that their circumstances are respected and that we have outreach that will reach someone's special circumstances.
I know you put on several events throughout the year too. QPR training, a candlelight vigil. the Metro East Out of the Darkness walk, for someone listening who wants to get involved or show up for this cause, what would you point them to?
Certainly through Glow for Hope and for any of the agencies that are part of the Suicide Prevention Alliance, any of us can give you information about these events or about how to be more involved.
Of course, we invite anybody in the area who's interested in walking in the Out of the Darkness walk to join Team Glow for Hope, and that information will be on our website. Um, Beyond the funded agencies, is there a role that everyday community members, organizations, or even other nonprofits can play in partnering with the Mental Health Board?
Well, I think that what we've been successful in doing is making agencies and concerned people aware of each other. For so long, agencies were working very separately and they're out in the community doing great work, but not necessarily partnering with each other. And so our funded agencies and our network of agencies has actually gotten very good at warm handoff referrals, knowing how to reach someone in another agency that may serve a person well. We're all a team of agencies within our network, and we would welcome anyone to be a part of that.
I know the Alliance has been good for me in learning all the different agencies and stuff in the area and all the things that people are doing and the information sharing and the connections being made. So I think it's great. Um, so if somebody is listening right now, Jody, and they're in a dark place or they know someone who is, what do you want them to know?
Well, I would want them to know that they are not alone, that there are individual people that care, and that many of those individuals work for agencies where they can get quality mental health and support services. Many times we hear someone say sort of glibly that there aren't services available out there. But in St. Clair County, there truly are. We have numerous agencies providing high quality treatment and care, and hopefully there's no wrong door. That by reaching out to crisis mobile workers, by reaching out to intake at any agency, you would be able to access services that are a help and that get you past this hard time in life onto something better.
So you don't often have the mic and a platform to say whatever you want to say. I'm putting you on the spot. What is there anything else that you've just always wanted to say or shout from the rooftops that you want people to hear? And this, I mean, this podcast is not just local; it's global. So,
Kelly, I guess I want people to know how special they are individually. I think we each spend so much time being critical of ourselves. We spend we spend our time in worry rather than our time in joy. And I'm just hoping that everybody that's listening has peace and joy in their hearts. I understand, and maybe this is something about mental health that needs to be better understood. Good mental health doesn't mean that everything's always easy, but it means that you're able to use your resources and your strength to make it through whatever it is that you have to get through. So, my hope is that you just keep at it and find your way through whatever it is that's in your path right now.
very good. And if you can't, well, obviously, if you're in a crisis, dial 988 or 911 and there are resources out there to help you.
Those layers of service are in place. 988 is in place locally. Mobile crisis response is in place locally, as well as reaching out to individual agencies for their support. Um, Reaching out to someone is the first step, and getting you to the services that will help.
But Jodi, thank you so much for being here and for the work you and your team do every day on behalf of people who have spent a lifetime showing up for everyone else. What I hope everyone takes away from today is this: it's never too late to feel better, and asking for help isn't weakness. It's the kind of courage that took a lifetime to build. Thank you for joining us on Glow for Hope. If today's conversation resonated with you, share it with someone who needs to hear it. Remember, your mental wellness matters, and you are never alone. For more resources and support, visit glowforhopenfp.org. That's glowforhopenfp.org. Stay connected, stay hopeful, and keep the conversation going. Until next time, keep shining.
This podcast does not and is not intended to provide medical advice. The information presented on this podcast should not be interpreted or construed in any way as a replacement or substitution for medical advice. It is important that you discuss your condition, treatment options, or any questions that you may have with your doctor or healthcare provider.